Stop scrolling if you are preparing for physiotherapy exams. In this video, I'll be solving 21 to 30th MCQ of GPSC exam held in 2025. Let's start 21st. Naproxen is an example of which group of drugs? Option A, corticosteroids. Option B, non-steroidal anti-inflammatory drugs. Option C, antiseptics. Option D, antibiotics. Naproxen is a pain-relieving and anti-inflammatory drug, so it belongs to the NSAIDs group, that is non-steroidal anti-inflammatory groups, same as ibuprofen and diclofenac. So option B, non-steroidal anti-inflammatory drug, is the right answer. Next, 22. Choose the incorrect statement for inferential statistics. Option A, it is used to test hypothesis. Option B, it involves selecting a small sample of people for the study. Option C, the result of the study allows researcher to make inference about the population from which the sample is drawn. Option D, it summarizes the main features of results from a survey by describing the average of score. Let's see what is inferential statistics. It makes the conclusion about a population from a sample. So option A, that it is used to test the hypothesis. Yes, inferential statistics is commonly used for hypothesis testing, example t-test, chi-square test, ANOVA. This test helps determine whether the results from the sample are statistically significant for the population. Now option B, it involves selecting a small sample of people for the study. That is correct, yes. Inferential statistics works by studying a sample and then making conclusion about a larger population. For example, studying 100 patients to estimate the result for 10,000 patients. So option B is the correct sentence. Option C, the result allow researcher to make inference about the population from which the sample is drawn. That is correct. Yes, that is the main purpose of inferential statistics, using simple data to draw conclusion about the population. For example, estimating prevalence, predicting outcomes and generalizing result. So yes, C is the correct sentence. And now option D, it summarizes the main features of the result from a survey by describing the average scores. Yes, here it is mentioned that describing, that means it is the sentence of descriptive statistics. Descriptive statistic includes mean, median, mode, standard deviation, percentages, so that only describes the data but not generalize the population. So option D is an incorrect statement here. So here the answer is option D. Now 23rd, choose the correct statement for neurodynamic testing of sciatic nerve. Option A, ankle dorsiflexion with eversion places more tension on sural tract. Option B, ankle dorsiflexion with inversion places more tension on the tibial nerve. Option C, ankle dorsiflexion with eversion places more tension on tibial nerve. Option D, ankle plantar flexion with inversion places more tension on tibial nerve. Option A mentions ankle dorsiflexion with eversion places more tension on sural tract. Yes, it's wrong, because dorsiflexion plus eversion places tension on the tibial nerve. That is why it is wrong. Option B, ankle dorsiflexion plus inversion places more tension on the sural nerve. Here it is mentioned tibial nerve. That is why it is wrong. Option C, dorsiflexion with eversion places more tension on tibial nerve. Yes, that is right. Option D, plantar flexion with inversion places more tension on tibial nerve. It is wrong. It places more tension on the comal peroneal nerve. So here the right answer is option C, ankle dorsiflexion with eversion places more tension on the tibial nerve. Now 24th, clinical presentation of crossed sensory or motor findings, nystagmus, diplopia, vertigo and Horner syndromes best describes which type of stroke? Option A, MCS stroke. Option B, ACS stroke. Option C, PCS stroke. Option D, brainstem stroke. Here let me first tell you, MCA means middle cerebral artery stroke, ACA means anterior cerebral artery stroke and PCA means posterior cerebral artery stroke. Option A, MCS stroke causes contralateral side of hemiplegia or hemiparesis, contralateral sensory loss, aphasia, visual field defect like homonymous hemianopia. So here it is wrong. Option B, ACS stroke, that causes contralateral weakness mainly in lower limb, contralateral sensory loss, then behavioral changes, urinary incontinence. So that is option B, here it is wrong. Option C, PCS stroke causes contralateral homonymous hemianopia, visual agnosia, memory disturbances. So the option C, PCS stroke, is also wrong. Option D, brainstem stroke. Yes, It causes nystagmus, vertigo, diplopia. Diplopia means double vision. Then Horner syndrome. Horner syndromes include ptosis, meiosis, and anhidrosis, as well as crossed neurological signs that is seen in brainstem lesion only. So here option D, brainstem stroke, is the right answer. 25th, positive Leishman test is suggestive of option A, anterior cruciate ligament injury, option B, posterior cruciate ligament injury, option C, both A and B, and option D, none of above. Let's first see Leishman test. It checks anterior translation of tibia relative to femur. So it evaluates ACL integrity, that is anterior cruciate ligament integrity. So option A is right answer here. Option A is anterior cruciate ligament injury. 26. A 65-year-old Mr. X is having impaired postural control. Which one of the following is not a contributing factor to his impaired postural control? Option A, coactivation of muscles. Option B, hypermobility of joints. Option C, tonal imbalance. Option D, impaired voluntary control. Option A, coactivation of muscle. Coactivation means simultaneous contraction of agonist and antagonist muscle. In older adults, this often acts as a compensatory stabilization strategy to improve joint stability during balance tasks. For example, during standing, both quadriceps and hamstrings may contract together to increase joint stability, so it may actually help to maintain posture, not impair it. Option B, hypermobility of joint. It can contribute to impaired postural control because hypermobility of joint causes reduced joint stability, poor proprioceptive feedback, difficulty in maintaining alignment, so this can lead to balance problems. Option C, tonal imbalance. It means unequal muscle tone between the muscle groups, for example tight hip flexors plus weak extensors, or you can say spasticity, so that distributes to postural misalignment and balance control also get disturbed. Option D, impaired voluntary control. If voluntary control is impaired, postural adjustments become poor and that will lead to instability. So yes, impaired voluntary control is major contributor for impaired postural control. So here the option A, coactivation of muscle, is a right answer. Now 27. In this question, two statements are given, one labeled as assertion and other labeled as reason. Read the statements carefully and choose the correct alternatives A, B, C and D as given below. Assertion A is meralgia paresthetica is also known as Bernhardt-Rode syndrome. Reason R is it is due to impingement or compression or irritation of lateral femoral cutaneous nerve when it exits pelvis. Yes, meralgia paresthetica is indeed called Bernhardt-Rode syndrome, and this condition also occurs due to entrapment of lateral femoral cutaneous nerve. Both A and R are true and reason explains assertion. So option A, both A and R are true and R is the correct explanation of the assertion, is the right answer here. Now 28. Which one of these is not a risk factor for developing lymphedema in a patient with cancer? Option A, the extent of surgery and lymph node dissection. Option B, radiation therapy. Option C, being overweight or obese. Option D, being underweight. Option A, extent of surgery and lymph node dissection can cause a lymphedema. Option B, radiation therapy is a cause of lymphatic obstruction and can cause lymphedema. Option C, being overweight or obese increases lymphatic load and impairs drainage, so it also a risk factor for lymphedema. Option D, being underweight is not associated with lymphedema, so here the option D, being underweight, is the right answer. 29th. In this question, two statements are given, one labeled as assertion and other labeled as reason. Read the statements carefully and choose the correct alternative A, B, C and D as given below. Assertion: persons who have considerable fat in the body are somewhat resistant to osteoporosis. Reason: estrogen is synthesized in the body within the adipose tissue. Yes, higher body fat increases estrogen level that will reduce the bone mass, so assertion is a right. And adipose tissue converts androgen into estrogen via armostat, so reason is also a true. And estrogen protects bone by inhibiting osteoclast activity, so yes, reason also explains assertion. So here the option A, both A and R are true and R is the correct explanation of the assertion, is the right answer. Now 30th. According to the level of evidence, level 3 evidence is option A, case control, case series or historical control studies. Option B, individual RCT with narrow confidence window. Option C, non-randomized control cohort study. Option D, systematic review or meta-analysis. Here, option A, case control case series or historically controlled studies is level 4 evidence. Option B, individual RCT with narrow confidence window is level 2 evidence. Option C, non-randomized control cohort study is level 3 evidence. And option D, systematic review or meta-analysis is level 1 evidence. So here the option C, non-randomized control cohort study is the right answer. Hope my videos are helping you to solve your MCQs. Thank you for watching. Do like, share and subscribe this video. Don't leave in between. I'm sharing next 31 to 40th MCQs in next video.